Hello, good morning or good afternoon, wherever you are. Uh, I know that a lot of you really like the tutorials that I do and demonstrations that I do, and we have put up a lot of the older massage videos. So now I'm going to be working a little harder to get you into understanding the subtle anatomy and how to work the subtle anatomy, because that's really important. And so today we're going to be showing you some of the work on the knee, how to work on an injured knee and what to look for and how to very carefully move it. So I want to thank you so much for being here, and we'll get started. So when you start on the knee, you want to find where the pain is at first. It's either going to be on the lateral or in the medial side, and that's usually where it is. That's where you'd prefer it to be. It can be above the knee or below the knee. If the pain is in the center of the kneecap, that's a whole different situation, and that's a much more difficult thing to deal with. So we hope that it's not there. Most all the knees that I see are pain that comes in from the attachments. I have had a couple knees that have been dislocated and working with those to come back into place. So I'm going to show you how to do that subtle work. So the first thing that you want to do is just kind of feel the rotation and the flexibility of the kneecap, if it's moving easy or if it's creaking, and check it in all directions. And of course, you can always ask the client if they will tell you when there's a bad pain happening, if that should happen, to let you know, because if it's in intense pain that feels so good, kind of like hurt so good thing, that's okay to have that. They can tell you if you want, but you don't really need to know that. But if it hurts in a bad way, you need to stop, because the body is telling you that that's not the way it needs to go. I don't get very many people that say they're going into bad pain unless I'm going into deeper stretch where there's already a problem. Okay, so we start there, and then I walk around and get to the foot part of the knee and bring myself underneath like I am supporting this. There's also a bolster that you can put under the knee, but sometimes it's better to work it flat. Just kind of depends on the condition of their back. And then what I do usually is I'll just go into the joint here, and I'll feel what's happening along where the joint of the knee is. And I'll just hold my fingers, find a spot that feels, this is where it's really hard to explain to you, because you have to feel for where you feel something that is drawing you into it. It's a very intuitive kind of thing to do to work this subtly. So you find the place that it's feeling like it's needing attention, and what you'll normally get is you'll get some kind of a pulse. So my back fingers are feeling a little pulse. Although Xarissa doesn't have any knee problems, I can still feel that there's a little bit of work that she does on her knees. So there's a little bit of correction going on. Okay, so I'm feeling some movement behind the knee, and it's on the outside of the knees in the back, not in the center of the knee. And then I'm going to hold here where the bones are, find a place, and then just allow that to begin to work. And what you're going to feel is you're going to feel a lot of kind of moving, kind of undulating. Sometimes it's waves. And my hands are, I don't know if you can see it, they're very slowly and with very little movement, they are moving. And I'm following her movement because we're unwinding tissue. So once that feels like it's done, and it'll kind of push you off, it's like it just lets you go a little bit. It kind of pulls you in when it needs you, and then it pushes you out. Then I check with my hand on top and grab to the bones underneath the kneecap and hold the femur bone on from underneath here, and just see how the bone wants to align in the alignment with the femur. This is the steady part. This is the stabilization hand. You're stabilizing the femur bone, and then you're going to let the tibia and the fibula will come along with it, but you're going to feel that this is going to be moving. Now, if you start to feel like in dislocated knees, it's going to go a direction, but then it's going to oftentimes stop and back up a little bit, and you just have to keep following that, and it'll sometimes require you to move a little bit with the femur. And if that's the case, then just move a little bit, but remember, you're still stabilizing there. And then you can just feel this all working. There's a lot of tissue movement here. Even though this knee is not in an injured state, there still is correction going on just from daily activity. Next, you can go to the side of the knee, particularly if the knee has been dislocated, because you're going to be working to get the knee to move into the alignment pattern, but you're not going to force it. So all I do here is I get myself comfortable by just leaning my arms on the table, and then so I'm nice and stable, so I can stay nice and still while I'm working this knee. So you put both hands together like that. Now let's imagine that the femur is going this direction and the tibia is going this direction. It's not going to be really pronounced, but you'll see it in the alignment if you look real carefully. So what we're going to do is we need to get that to go a little bit this direction, and we need the tibia to go this direction. So you're going to apply a little more pressure to the palm of the hand here, and a little more pressure to the fingers on the other hand for the femur bone. And you're going to just, again, meld into the body, make it feel like you're connected with like magnets, and then put a little more pressure on those two places to get the bone to start to move. And then just go very, very, very slowly and let it unwind and twist around and do what it has to do, and you'll feel it moving into place very, very slowly. One thing about this work is you've got to be really patient, and you also need to just let the body tell you. And I think that's one of the hardest things for people to do, is to just get out of their own way and just honor what the body's telling you and learn how to communicate that way. Now, what's real interesting with this is there's no actual knee injury here, but this knee is going into an alignment. There's a little bit of misalignment that's happening, and it's moving just a little bit. It's very slight, and it's rolling a little bit. Okay, so then you just feel it, how that's working there. Now the next thing that you want to do is, usually when all this is misaligned, you're going to have a misalignment down in the cuboid bone. The cuboid bone is a little cube that's at the end of this tarsal bone, the metatarsal, and then where the tarsal is, there's a little cuboid bone right here next to the heel. That's the calcaneus. So you're going to grab a hold of the cuboid bone, set the heel back down on the table, and then you're going to find the joint between the tibia and fibula, or very close to it. Sometimes it'll pull you in right in the joint, and sometimes it's a little bit around the joint. So be attentive to where the body is telling you to go. And what you're going to feel here is you're going to feel a connection between this bone in the foot, the cuboid, and the joint of the tibia fibula. And you're going to feel it, and you can see my hand kind of moving. I'm moving with some of the tissue unwinding going on. Oftentimes what happens with knees, unless people just fall down, is something will be off in their body and the heel strike will not be in alignment, and so that will take the knee a little bit out of joint little by little. So the heel strike is real important when we walk. And there we go. And there's a lot of movement here, so she's making some corrections. And then of course you can check the alignment here with the ankle, which we've shown. You can just press that and make sure that that's aligned. And if there's fluid, oftentimes there is fluid in around the knee, what you do there is a little bit of lymph, just kind of push that fluid up. You can open other nodes, and especially behind the knee, a lot of times that's real tender, but you don't want to go hard with that. So I'm just doing some lymph pumping behind the knee, and make sure that you can take some of that swelling down. You can also just pull it like so, but you take it in kind of that direction for the lymph fluid, and let it go like that. And you can then check just the flexibility with the knee underneath, and just check to see how well they can flex it. Sometimes they can't flex it very well, but you just take it up and down and watch that alignment. And so if you do that with knees and you pay attention to staying very subtle with it and get into the movement of the body and let the body speak to you, you'll be surprised at what you can do to help people's knees. If their knees are in a very arthritic state where there's decomposition of the bone, things like that, then that's a whole different issue. This is primarily with somewhat healthy knees or knees that have been just knocked out of place, or they hurt because of the heel strike, or they fall down and kind of twist it. Those sorts of things are where this is going to be the most effective. But where there's bone deterioration going on, we've got a whole different issue there, and that requires a lot more work and a lot more things to do. So with that, I will say thank you so much for watching, and I hope you got a lot out of this, and I'll see you later.